Well, we conducted this study to compare the benefits and the risks of modern breast cancer radiotherapy. And in the EBCTCG, or the Early Breast Cancer Trialists Collaborative Group overview, we've already shown that for suitable women, breast cancer radiotherapy improves or prevents death from breast cancer in suitable women. So breast cancer radiotherapy saves lives. But our EBCTCG analyses have also shown that radiotherapy can increase the risk of second cancers and of heart disease. So we did the study to compare the benefits and the risks of breast cancer radiotherapy for women today. Well, we were able to include data on more than 40,000 women with early breast cancer who were treated in randomized trials of radiotherapy. And there were 75 randomized trials. And one of the reasons we were able to include data on so many women is thanks to the many hundreds of EBCTCG collaborators, many of whom are here today. So this is not my study, this is a study from EBCTCG, and it's been a real collaborative effort. Well, the main risks in the trials were lung cancer and heart disease. And what we did is we estimated the 30-year risks for women being considered for radiotherapy today. And we showed that for a specific group of women, i.e. women who started smoking in adolescence and who continued smoking on after their radiotherapy, the risk of breast cancer radiotherapy is around a few % risk of developing lung cancer. We also found, though, that for ex-smokers and for women who had never smoked, the risks of breast cancer radiotherapy were less than 1%. They were very, very small. And the reason for that difference is that lung cancer is 20 times more common in a smoker than in a non-smoker. So a 50% increase in a smoker's risk is much bigger than a 50% increase in a non-smoker's risk. And also we found that for heart disease, the risks were much smaller than that. Well, I think for many of us clinicians here today, these results are good news. So in my practice and in the practice of many oncologists here at the San Antonio Breast Cancer Symposium, we can now achieve very low doses to the lungs and to the heart in breast cancer radiotherapy. But that isn't necessarily true worldwide, and in some centres, doses to the lungs and to the heart are much higher than those. But for many radiation oncologists here today, the results are good news. With regard to smoking, many of the women seen in my cancer centre are non-smokers or ex-smokers, and I can now reassure them that the benefits of their radiotherapy are likely to far outweigh the risks of their radiotherapy. But even for women who are long-term smokers since adolescence, they can substantially reduce their risk of radiation-related lung cancer by stopping smoking. So I think that's a very practical message for us oncologists in the clinic.